May is Mental Health Awareness Month.
And on that point, we are drawing attention to just how common mental illnesses are here in the U.S. In fact, the CDC, which counts this kind of thing up, says more than half of all Americans will be diagnosed with a mental illness or disorder at some point in their lifetime. Meanwhile, the World Health Organization has said that global prevalence of anxiety and depression increased by 25 percentage points during the first year of the COVID-19 pandemic.
And joining us now is therapist and author of the Dear Therapist column at The Atlantic, Lori Gottlieb. She's also co-host of the Dear Therapist podcast and author of the book, Maybe You Should Talk to Someone. Lori, welcome. Thank you so much for being with us today. So, let's start just about talking about the importance of Mental Health Awareness Month and having a set time to allow people to really acknowledge the prevalence of mental illnesses. So tell us how you're marking this month.
Yeah, I think it's really important that we talk about what we're going through because I think so many people who are struggling feel like they're struggling alone. So I'm giving people a challenge every week. And this week's challenge is I want them to really listen to somebody because I think that we need to learn not only to reach out, but how to listen when people do reach out to us.
Lori, there have been a number of high-profile suicides this year, as there are every year. And I'd love to hear you talk about whether or not there's a connection between those public events and trends with people who are not celebrities.
Yeah, I think that what happens is when you see this happen with celebrities, I think that people realize that something that they've been struggling with is not unique to them. And so these tragic events, I hope will help people to reach out when they need help. And I think that the fact that people are talking about the real struggles that celebrities are having just makes it people more able to reach out.
Hey, Lori, I remember on the morning show we had Congressman Jamie Raskin on, who lost his son to suicide. And we asked him if he had any advice for parents. And this was an adult son, an adult child. And he said his one regret was, and he's since learned, that he should have been frank about the word suicide with his son. Rather than saying, "Are you okay?" he should have said, "Are you having thoughts of suicide?" Is that good advice? Is he on the right track there?
That's fantastic advice. People feel like if I bring up the word suicide, it will plant the idea in their head. Could not be farther from the truth. The truth is that it's a relief to people who are thinking about that because now they know that they're allowed to talk about it.
But what about a lot of parents who struggle, Lori, with the question about how to talk to their teens, for instance, about it? Because, we hear that there's such a thing as copycat suicides, right? That when it happens at a college or a high school, the fear is that other young people will follow suit. So how do you balance talking about it openly with making sure that, other teenagers don't have that same idea?
Mm-hmm. People who are contemplating suicide are in a lot of pain. And I think that when someone opens up the conversation and uses the word suicide, people realize, they understand how much pain I'm in and how dire this situation is. And they're generally very, very relieved, especially to talk to their parents about it because teenagers don't know who to reach out to. And when they know they can trust their parent to handle the information and to help them, they're going to feel very relieved by that.
That's really great advice. Thank you, Lori. And then also, with kids, but also with friends, there's a fine line between being encouraging and helping people, tough it out or get back on their feet. And then when it becomes not encouragement because they've got more than just a one down day, it's something deeper. How does a person know the line there between helping a person's resilience and pointing them toward maybe they should talk to somebody, to use the title of your book?
I think that if somebody is struggling on an ongoing basis and it's not getting better, that they definitely should talk to someone. And there's no stigma around that at all. I think therapy is like getting a really good second opinion on your life from someone who's not already in your life. And whether you're struggling with something like suicidal thoughts or you're feeling sad or you're feeling anxious, whatever it is, there's no hierarchy of pain. If you are struggling with something, you should reach out and you should talk to someone. And sometimes that person is a therapist.
All right. Well, the book is called Maybe You Should Talk to Someone. I'm glad we talked to you today, Lori.
Yeah.
Thank you very much.
My pleasure. Thanks so much.
If you or someone you know needs help, the National Suicide Prevention Lifeline Network is available 24 hours a day, 7 days a week. You can call their hotline. It's 1-800-273-TALK. And you can also find them at suicidepreventionlifeline.org.